Hi, I'm Tunde Yerokun. I'm a PGY8 in cardiothoracic surgery, and I did my training through the joint training program, which is a combined general surgery and CT surgery training pathway. In terms of why Duke, Duke has a very long track record of training great surgeons, both in general surgery, cardiothoracic surgery, and many other of the training programs here. Part of the reason I came here was the emphasis on academics. The cardiothoracic surgery training program here over the past 10 years has had only 6 people not go into academic surgery as their first job, and 2 of those people were in military. So not only do they speak about training academic surgeons here, but they also have a proven track record for it. So that was one of the main reasons why coming here. Another reason was the operative exposure here at Duke is quite vast. You do a lot of cases, and as opposed to potentially other places where you're assisting, here at Duke, you're actually doing the operations and you're on the right side of the table. Those are really the 2 big reasons, both the academic training and the research that comes with it, as well as the operative exposure. Yeah, the joint training program, it seemed to be a natural fit for me. The benefits of it are the early exposure to cardiothoracic surgery, which started in my clinical 4th year of general surgery. So that was the main reason for me picking it, just the early exposure to cardiothoracic surgery. In addition, the faculty in cardiothoracic surgery are super supportive and beneficial, and the early exposure to the training also affords you early exposure to them as well. So, in terms of the support structure here, it's really good. The program directors and program assistants are great at doing what they do, but I guess it kind of starts from the top in terms of the leadership, and the Department of Surgery, led by Dr. Kirk, really emphasizes making sure that residents are taken care of. And I remember when he came here, one of his first things in doing here was creating a space for the house staff to gather that was a lot better than the place we had before. And this place has, a couple fridges, microwaves. They provide us with snacks and drinks, including free coffee and soft drinks as well, which, while might not seem like a lot, actually mean a lot when you're in between cases. So that starts with Dr. Kirk, but then also in terms of the cardiothoracic leadership, Dr. Smith has been a huge proponent of making sure we as cardiothoracic surgery trainees are well taken care of, and he's very thoughtful in making sure that while we still get our training, it is done in a very well manner. And then finally, just the rest of the faculty, and then the house staff. Because we are probably one of the larger training programs in cardiothoracic surgery, there are more of us, but I think that is a benefit because we all really do have each other's backs, and then it makes it a lot easier to cover for someone when either someone has some family event, or someone is in maternity or paternity leave. It makes it a lot easier to cover since there are so many bodies available. Yeah, in terms of my future career plans, my plan is to be an adult cardiac surgeon who practices or does academic medicine. And in terms of the preparation for actually doing cardiothoracic surgery, it is my belief that you can only be prepared to do that by doing as many cases during training And again, one of the big benefits of this training program is we stay very busy clinically in terms of transplantation. I believe last year we were number 2 in the nation in terms of lung transplantation and number 3 in the nation in terms of heart transplantation. So in terms of transplantation alone, if you're looking for a place to train and do transplantation, thoracic transplantation, this would be the place. In addition, we do a lot of mechanical circulatory support in terms of durable LVADs and do a fair amount of ECMO as well. And then finally, we do a lot of structural heart stuff and aortic procedures as well. And then on the thoracic side, we are very busy in terms of esophagectomies and pulmonary resections and other benign esophagus, including more newer procedures such as TIFs and POEMs and whatnot. And then lastly, on the congenital side, that side is getting very busy with the new leadership there with Dr. Turek. So in terms of the preparation for my career after I finish here, I feel like not only on the academic side I would be ready to do that, but also in terms of being actually able to operate, just given the clinical volume and breadth here, I'll be more than comfortable being a CT surgeon.